Hi everybody, my name is Shanelle Van Dyke, and today I'm going to provide a quick little 15-minute webinar presentation recording on the Patient Safety Culture Survey and how there's still time to participate for the Wyoming hospitals. So I'm going to quickly give an introduction to the purpose of the patient safety culture, the benefits, as well as a recap from the Wyoming QI Roundtable patient safety culture presentation that was done back in November. I'm going to go over the commitment as well as expectations from you and us, what participation entails, and then a little bit about the actual survey and next steps for this current Flex Grant year. So as part of the goal to support a culture of patient safety and quality improvement in the nation's healthcare system, the Agency for Healthcare Research and Quality, also known as AHRQ, sponsored the development of the patient safety culture assessment tools for hospitals, nursing homes, and outpatient medical offices. And since then, it has actually extended to even more medical practices. Back in 2004, AHRQ released the hospital survey on patient safety culture, a staff survey designed to help hospitals assess the culture of safety in their institutions. Since then, hundreds of hospitals across the United States and internationally have implemented the survey and continue to use it today. The concept of the safety culture originated outside of healthcare in studies of high reliability organizations that consistently minimize adverse events despite carrying out complex and hazardous work. High reliability organizations maintain a commitment to safety at all levels, from frontline providers to managers and executives. This commitment establishes a culture of safety that encompasses these key features: acknowledgement of the high-risk nature of an organization's activities and the determination to achieve consistently safe operations. A blame-free environment where individuals can report errors or near misses without fear of reprimand or punishment. Encouragement of collaboration across ranks and disciplines to seek solutions to patient safety problems. Organizational commitment of resources to address safety concerns. So the purpose. The need for the survey was identified by hospital peers throughout Wyoming and is being generated by myself through my consulting business, Quality Reporting Services, and I'm doing it on behalf of the Wyoming Department of Health, Public Health Division, Office of Rural Health, with funding from the Medicare Rural Hospital Flexibility Grant through the Health Resources and Services Administration. So the Patient Safety Culture Project is being administered in 3 segments and grant cycles. So the first initial segment began back in the 2015 to 2016 Flex Grant cycle, and during that first segment, the survey was administered to 5 Wyoming critical access hospitals who were the ones who originally expressed interest by having baseline results compiled. So the next Flex Grant cycle, which we are actually currently in, is the 2016 to 2017, also known as Segment 2. And the purpose of this segment will be to collect, after the baseline data was collected, to use it to improve the patient safety culture measures in each individual critical access hospital. So this Segment 2 is all about quality improvement. And then the final segment will be completed during the Flex Grant cycle, which is 2017 to 2018, where the survey will actually be re-administered for remeasurement. Actually, one thing that I want to mention, I'm going to get to it in more detail on the next slide. As you're looking at these timelines, you're like, how is this fitting? We did do a presentation back in November of the original 5 CHs who participated in the baseline, and there were a influx of like 7 or 8 additional hospitals who wondered if they could still participate. So the reason for this presentation today is we're extending it so that with a very quick turnaround, and that's the main reason for this quick presentation, is to express in details the quick turnaround and how you can still participate. But anyways, the reason for this is if you want to still participate, there's still time. We can administer the survey at your hospital and then get the results back to you so that you can start participating in QI activities. And I'm going to get into that in a little bit more detail. I just didn't want to throw you off by going through those dates and segments. The benefits, so this Wyoming Critical Access Flex activity is intended for the following purposes. Comparison to allow hospitals to compare their survey results with those other Wyoming Critical Access hospitals that are participating. Assessment and learning to provide data to the Wyoming Critical Access hospitals to facilitate internal assessment and learning in the patient safety improvement process. And then supplemental information will include helping Wyoming Critical Access hospitals identify their strengths as well as areas with potential for improvement in the patient safety culture. Trending, I'm going to provide you with data that describes changes in patient safety culture over time, meaning we're going to not only give you your baseline, but give you a side-by-side comparison nationally, and then give you a side-by-side comparison of your results with all of the aggregated results of the Wyoming Critical Access hospitals that are participating, and then do the same thing later on down the road with remeasurement. So how this came about, as I mentioned, there was a Wyoming QI roundtable that took place back in November, and I had shared the patient safety culture update and findings at that meeting, and it prompted more critical access hospitals to want to participate. There were like an additional 7 or 8 that wanted to participate. So as a result, it was decided to open it back up to the additional critical access hospitals, and interested CAHs are going to be given, or were given, the opportunity to email Kyle Cameron to express their interest. Several of you reached out to Kyle, said you were interested. So after we got the estimated amount of participation, which was about 7 or 8, the numbers were crunched to make sure it was possible and that we could accommodate each hospital that was interested. And I was able to determine that I had the time to do it, and then Kyle was able to determine that there was enough flex funds available for the flex grant to pay for this to be done at your facility. So what this means is you, after you listen to this presentation, you have to send a confirmed commitment to me via email and Kyle. If it just goes to me, that's fine. I will make sure Kyle gets it. But if you want to make sure, send it to both of us. But we need that no later than February 10th. If you get it to us after February 10th, I'm sorry, we got to shut it down. We got to get a cut off, at some point, and February 10th is the drop dead deadline. So here today being Monday, you're just getting this. It gives you all week to review this quick presentation and get us a response. This presentation is intended for you to know what the commitment is and what the quick turnaround is, so you know what you're committing to. Once we get that commitment, I will contact you directly and work with you directly. I will provide you with the hospital patient safety culture survey, as well as promotional materials like this presentation, the slides. There are some promotional flyers and any additional materials that you might need to help you administer the survey in your hospital to your staff. Now, this is a really quick turnaround. Back when we did the baseline, it was, I think 3 or 4 months that we gave facilities. But right now, because the baseline was already done, we are asking that if you are going to agree to participate, that you will only be given until March 6th, which is just a little under a month, to return all the completed surveys to me. Then it gives me a very little window of opportunity to calculate and return your results in the patient safety culture report portfolio format by the middle of March, so that you can start effectively participating in the patient safety culture quality improvement activities that are going to start taking place in March. Outside of that, I can compile a webinar recording for your hospital that's specific to your results that you can then distribute and share amongst hospital staff. So it'll be similar to what I'm doing now. It'll just be a recording. I'll send it to you. You guys can distribute the slides and the link that staff can access on their lunch hour, whenever they have time to listen to it, to know what was done with the survey, how the results were compiled, and what the findings were, as well as next steps for what we're going to do. Your commitment is not only for this year's baseline and the improvements, but also for next year's remeasurement. So it's not just for you to participate in one round of the survey. It's to do the survey, participate in all the activities this next year, and then also participate in remeasurement. So expectations real quickly. You were to email a confirmed commitment to myself and Kyle by February 10th. I will then work with you to distribute and administer the patient safety culture survey within your facility. You are then to return completed surveys to me no later than March 6th. I will then calculate the results and provide you with the findings as well as the patient safety culture report portfolio. That will give you your findings and a side-by-side comparison of how you did nationally. And then once all the findings are in for all the Wyoming hospitals, you will then get another report with your results alongside of the aggregate of all the Wyoming critical access hospitals. You're then to review your report portfolio and provide feedback. And I will then create patient safety culture findings webinar recording that's specific to your hospital. You're then encouraged to obviously distribute and share those findings and that webinar recording with all of your hospital staff. From then on, starting in March, I will create and facilitate all quality improvement activities related to the patient safety culture improvement. And then we are encouraging the hospitals that are participating to also participate in all of the QI activities related to the patient safety culture. And then, of course, later on down the road, I will administer and calculate the remeasurement results, and then you are also obviously expected to participate in the remeasurement. Participation, if you send us your commitment by the 10th, this is what's kind of being expected. Once you've received your report portfolio with your calculated survey results, the participation that we're asking from you will involve attending and actively participating in the monthly QI patient safety culture webinars, participation in the quality improvement activities focused on the patient safety culture include items such as but are not limited to quick touch base huddles with me over the phone where there's just a 5-minute huddle saying, hey, how's it going? Are you having any problems? What are your barriers? What can I do to better help you? Sharing lessons learned and best practices. So, for example, on one of the webinars, we might ask if you're doing really stellar in one area, but there's a handful of facilities that didn't do so great. We might ask you to talk about what you're doing at your facility and why your results were so high in that, why you think the results were so high in that area, and vice versa. If you're not doing so great in an area, but there's another hospital that was, we're going to encourage them to share, you know, what they're doing at their facility that's working to make those results so high. In addition to that, we're going to talk about sharing and discussing barriers that facilities are running into, how to get around those barriers, how can myself and the other facilities that are participating help you address those barriers, network with other critical access hospitals that are participating, and then providing feedback to me so that I can better assist you and your facility with improvement. I want to make sure that this adds as much value as possible, so when we do the remeasurement, we're actually making an improvement in your facility, and that obviously by you participating in this year and next year, it's going to be adding value to your facility. A little bit about the survey and its content. The hospital survey was designed to assess hospital staff opinions about patient safety issues, medical errors, event reporting, and the survey includes about 42 items that measure 12 areas or domains, also known as composites, and I'm going to show you that on the next slide. The survey also includes 2 questions that ask respondents to provide an overall grade on patient safety for their work area and or unit and indicate the number of events they reported over the past 12 months. So in addition, respondents are asked to provide a little bit of limited background demographic information about themselves their work area, staff position, whether they have direct interaction with patients, how long they've worked in their unit in your hospital, and things of that nature. So this slide right here provides on the left-hand side, the 12 composite and/or domains. And then on the right-hand side, it gives you a little bit of definition of what each domain entails. So just an example, teamwork within units. It's about staff supporting each other, treating each other with respect, and working together as a team. And I'm going to leave this up on the screen for a minute while I talk about something. Now, a lot of small critical access hospitals have not a large number of staff. And staff feel when they provide the demographic information, like, for example, I'm going to use, if you have one pharmacist, and that pharmacist that, identifies on the survey that they are the pharmacist, then they're worried that obviously by them being the only pharmacist in your facility and by them stating they are the pharmacist within the survey, that they're going to be identified and that their results are going to be known to everybody because they're the only one. If a staff member feels that way, they do not have to disclose that. Like if it's a department that has less than 5 people in it, they do not have to specifically state what their position is. They can just simply state their department. Or if they're just a department of 2, they don't have to provide their department. The main goal of the survey is to have the best possible findings that your staff can give about their perception of patient safety in your facility. And so we want them to feel comfortable with filling out the survey honestly and accurately. So if they feel that they are going to be recognized, any items that make them feel that they're going to be recognized, whether it's how long they've worked at the facility, what department they're in, or their job title and or position, they do not have to provide those. That's just demographic information, and it does not affect at all the survey results of the patient safety opinions from the survey, if that makes sense. In addition, on the survey, at the very end, there's an option for them to add comments. And again, some staff feel that they're going to be identified by their handwriting. Again, you can put them at ease, letting them know that when they get the survey, when they're done with the survey and they're mailing it directly to me, I'm the only one that is going to see their comments and their handwriting. I will be compiling all of the surveys into a database, and only the hospital is going to get the aggregated results. You're not going to get the individual line-by-line results from each survey. So if they do write any comments, I do type those up on a slide, but you won't be able to identify them by handwriting. All of this can be addressed further if you decide to participate. When I have my first initial one-on-one call with you, we can discuss this in more detail. So a little bit about the Patient Safety Culture Survey report. Your hospital results will include respondent demographic information, composite level results, which breaks it down into those 12 domains that I talked about, and then item level results, which is actually how every single question was answered. So if you have 20 staff that returned the survey, then you will see an aggregate number of how question number 1 was answered by all 20 respondents. Question number 2, how it was answered by all 20 respondents. You'll get the overall patient safety grade, the overall number of events reported, as well as survey comments. Then the comparative results, again, will be a side-by-side comparison of your hospital next to the national results, and it'll break it down by the composite level, again, those 12 domains, and then the item level results, which is every single survey question, the patient safety grade, and then the number of events reported. Next steps, where do we go from here? So plans for this Wyoming Critical Access Hospital Flex activity. Again, we're going to do monthly QI activities focused on improvement. We're going to have quick touch-base huddles. We're going to do education and training. We're going to distribute and implement tools and resources that help with improvement. It's not going to be like, hey, I found this tool, give it to you guys and say best of luck. It's going to be hands-on. We want to ensure that we're making an actual improvement. I don't want to just find a tool that I know has been known to work nationally and ask that you guys use it and expect it to work. I want feedback. I want to know what's working, what's not working, so that if we do try a tool and you guys find out, hey, this isn't working for us, then we can go back to the drawing board to find something that does work. Again, we're going to share lessons learned and best practices, and that's it. I want to wrap up this presentation just because I wanted to try and keep it under like 15 or 20 minutes. This just provides you with an overview of what's being asked and expected if you decide to participate. Again, you have until this Friday to email myself and Kyle to let us know if you're interested. From that, I will email you back and try and work with you to schedule a date and time to have our touch base call where we can plan how we're going to distribute it at your facility, and then answer any questions that you might have or concerns or whatnot about the survey. And from there, we'll start working on the quality improvement activities that, again, are going to be taking place next month. If you have any questions after you view this presentation, please feel free to email me directly. It's chanelle.vandyke@qualityreportingservices.com. And I apologize, I see on this last slide that my email address got cut off a little bit. But again, when you get this information from me, it's going to be in an email, so feel free just to reply. Thank you, and hope to hear from you soon.